Hi, I'm Rob, and this is Life Rewired. Thanks for joining us again this week, and today I have a very special guest. We refer to him as Dr. B. Hi, Dr. B. How are you doing today?
I'm good, Rob. Thank you very much for having me today.
My pleasure. I understand you are a chiropractor.
That's correct. Yeah.
What state are you from? I'm trying to ask.
What's the which?
What state are you from?
A state, Washington.
Washington State. Awesome.
Washington State, and I also practice across the border in Canada, in British Columbia, close to Vancouver. So two locations.
Nice. Yeah, your assistant had reached out to me and said, hey, he might be a really good fit for your program. And yes, you're absolutely a great fit. We haven't had any perspectives from anyone in your field yet. I know a lot of people do benefit from the chiropractor. I do go to a chiropractor myself for benefits. So what is a good starting point for someone that's got a brain injury, it comes to see a chiropractor? What are some things that you're looking for and some benefits that you can offer them?
The key components, so based off of my history of what was misdiagnosed as a brain injury for me when I played college football, was the overlooking the possibility that the trauma that I experienced somehow affected my upper neck and the top two vertebrae in my neck and the ligaments that hold that region together. And so the diagnosis of the concussion that I received was just the tip of the iceberg compared to what truly was the damage caused by that event and potentially the cumulative hits leading up to that event, which could have been the straw that broke the camel's back scenario.
Right.
But at the end of the day, what I look for when patients come in to see me is their lack of response to many conventional therapies that are trying to address either visual issues, vestibular issues, concentration issues, memory issues. Sometimes they even have things such as heart palpitations, digestive issues, respiratory issues. They may have been diagnosed in addition to the head trauma with something such as POTS. They may have been diagnosed with dysautonomia. They might have been diagnosed with chronic fatigue syndrome, fibromyalgia. Those are just a few of the common diagnoses that people present with that ultimately do not deal with causation. They deal with symptom patterns. So those medical terms, diagnoses, simply describe the symptoms the patient is having.
Yeah.
And so I've, because of my own issues over the last 30 years, been doing a lot of digging and searching and discovery, and that when patients present with those types of symptoms and the conventional physiotherapy, chiropractic, osteopathy, naturopathy, physiotherapy, massage doesn't give result, and potentially even when the manual components are utilized on those patients, it actually flares them up, would be an indicator to me that there's a likelihood that whatever trauma set this all off did damage to the ligaments of the upper neck, and that the patient is suffering from upper neck instability. And when the bones are unstable in the upper neck, they have a tendency to irritate the brainstem and everything that branches off of it, and cause narrowing or a restriction of flow of the cerebrospinal fluid through that region, resulting in a potential back pooling into the brain and then yielding brain-like symptoms that aren't originating from a core fashion from the actual brain, but from the reduced drainage at the level of the brainstem due to the unstable upper spine.
Is there a particular symptom that should be a red flag for us to say, hey, this is something I should go seek treatment for from a chiropractor?
Not specifically a chiropractor, because we're mechanically based physicians, and so we look for malpositions or something being out of alignment. And I know from my own personal experience, when I went through the training, there wasn't much focus, if any, put on diagnosing instability. Everything was geared around diagnosing restrictions. And so knowing what I know now and having lived through what I have lived through for the last 30 years, I present as a patient with restricted range of motion and what seem to be restrictions in the joint mobility and fixations in my joints, which I myself as a chiropractor in a previous life would have picked up as I need to adjust those back into place.
Yeah.
And that seems very logical. And for the most average patient, that is perfectly exactly what they need, and they have, miraculous results. But patients presenting with, dizziness, nausea, constant pain at the back of the skull, headaches, blurry vision, ringing in their ears, heart palpitations, digestive issues, balance and coordination problems, shortness of breath, sometimes even erectile dysfunction, and you can go all the way down the gamut of potential things. Those are yellow/red flags that maybe there's instability in their upper neck and it's not just brain related. And that, doubling back to what I was just talking about, because I and other patients present to a chiropractor or anybody else who's doing manual medicine with what appears to be restricted ranges of motion and joint fixations, we're, again, not trained to discern whether that's a true joint fixation or if that's the compensatory muscular rigidity that occurs around an actual sloppy joint or a loose joint as a protective mechanism. And so I've learned to discern the difference between this is just a pure joint restriction, or this is what appears to present as a joint restriction, but it's actually truly an underlying instability, so the joint's moving too much. And the muscle guarding mechanism gives the appearance of a restriction, but it's a false restriction. So if I address it from a therapeutic standpoint in trying to reduce the restriction from a sort of forceful manual fashion, the patients will get flared up. And I've been that patient before. And so what I've discovered over the years is that the resetting of the neuromuscular interface of these guarding muscles and then taking them out of their overly guarded state and returning them into a responsive and sensory fashion where they can sense things going out of alignment and realign them actively as that's happening on a repeated basis, that the patients will have less symptoms neurologically, and they'll have more range of motion, and they'll feel better in general until those muscles have been overworked fighting that instability, and then they go rigid again.
Yeah.
And then all it takes is basically resetting those muscles again. And that's a daily process that I undergo many times throughout the day to hit the reset button on my own muscles. And all it takes is sustained pressure on specific muscles to get them out of that rigid state and get them sensing and responding again. And then as they do that, they can actually realign what is a repeatedly misaligning joint, which then provides a scenario where there's less irritation to the brainstem and less neurological symptoms, and potentially also less of that restricted drainage of CSF, therefore less back pressure into the skull, less brain-like symptoms. And that's been evidenced, thousands of times in my clinic and other places where, therapists have implemented these techniques as opposed to the sort of manual repositioning techniques, if you will.
Gotcha. I know at our local chiropractor, they have a lot of different treatments that they do, and I don't know if it's specific to chiropractic or if it's just what they deal with. But have you ever used anything like oxygen therapy or have a mat?
Yep. I mean, I haven't personally used it in my clinic, but I've had patients who have gone to other facilities that implement those types of therapies, and they do obtain benefits from that. The only question I would double back on asking is, well, if you look at the neurophysiology of what the vagus nerve is responsible for, and again, that's probably the most important nerve that branches off of that part of the brainstem that would be impeded by upper cervical instability.
Yeah.
So it's responsible, again, for respiration, heart rate, blood pressure. So when you have glitches in those systems, you may not truly be having a cardiovascular or a respiratory problem requiring more oxygen uptake, but the system of governing the proper oxygen uptake, which would be the vagus nerve, which senses that in the background automatically all the time and is somehow creating equilibrium and homeostasis nonstop, might be impeded due to this upper cervical instability. Yeah. And so, I even wrote a book on the vagus nerve and how one can reset their vagal tone. And that's a really important thing to know when you're dealing with concussive and brain-like problems, because it's a repeated necessity to force a reset in that system. But does that reset last? And if it doesn't last, it's probably because of mechanical forces being elicited on the vagus nerve. It's not to say that it's not effective. Right. All I'm saying is that it's rarely cut and dry as a person needs more oxygen, or they need more of this, or they need this supplement that they're deficient in, or that they need to get rid of this thing because they're toxic in it. It's a constant biofeedback system that doubles back to the vagus nerve every single time. And so Oxygen is just one of those things. And if a person's, for example, like I said, having digestive issues, having blood pressure issues, having heart rate variability issues, having urinary issues, having visual issues, hearing issues, one should, as a physician, think to themselves, well, how can they possibly be having actual glitches in those systems as a separated system, so that there's an actual urinary problem, there's an actual digestive problem, there's an actual heart problem, there's an actual lung problem.
Yeah.
People don't generally present with actual problems in those areas. Right. What I've discovered is that all links back to the vagus nerve and the brainstem. And so if there's something impeding flow or proper discharge of neural impulses from that region, because it spreads out to all those different systems, those systems could be glitching, not because the actual system is glitched, but because the electrical impulse from the vagus nerve to that system is inadequately firing at the wrong time. So, for example, people could have acid reflux problems, so GERD, and they're having an acid reflux without the presence of food, which is not a normal response for the stomach. The stomach releases acid as a chemical response to sensing food. Well, right. If the vagus nerve gets stimulated and the vagus nerve branches off of the brainstem with multiple roots, and say these two roots might be responsible for heart, these two might be responsible for lung, then you get to digestion and further down. So if some of those roots are being irritated by that instability in the upper cervical spine, you might just have an acid reflux moment in the absence of food that was initiated by the stimulation of these upper roots that have then traveled through the vagus nerve to stimulate the stomach to release acid. And then lo and behold, the people go see the doctors and they get, hydrogen inhibitors or hydrogen blockers, right? So that they don't release stomach acid, but then that screws up the system of how we digest, because acid is not being released even when it's needed to be released. And then you go down the cycle and you get a whole domino effect. So I would always say when there's multiple systems that are or parasympathetic in nature, so, vagus nerve mediated, that are glitching, look back to the vagus nerve instead of trying to hone in on what's wrong with the actual heart or what's wrong with the stomach, because it's rare that I've had a patient that has been found to have a problem there. And some have even undergone open heart surgeries for things that were discovered that were, supposedly birth defects, patent foramen ovalis and things like that in between the heart chambers, that after they had the open heart surgery, they still had heart rate variability problems and they still had high blood pressure and they still had POTS. And so the things that were found were not truly the causes of the symptoms they were presenting with. It doubled back to the vagus nerve.
Wow. Now, I have an example that might contribute to that. You've just touched on something that really made a click go off. I had to go to the emergency room because I thought I had constipation that I couldn't go to the bathroom. Well, it wasn't constipation. That I was, first of all, misdiagnosed for having constipation, and it wasn't that at all. It was my bladder. I couldn't urinate, but my brain was telling me I couldn't poop. Mm-hmm. So would that be a part of that?
Absolutely. There's a biofeedback between the different organ systems that when one is plugged up or somehow impeded, the other one will also disengage. So I recently had somebody that I know as well who had a majorly impacting kidney stone, where the fluid from the kidney was not actually draining down the tube into the bladder. Goodness. So this individual's kidney actually expanded to twice its size, and that presented as constipation.
Wow.
And so had there not been a CT scan done on that individual, they would have just assumed, let's laxate, this individual, which they proposed. But thankfully they decided to do a CT scan and said, wow, you've got a massive kidney stone that's blocking the drainage of your kidney, and your kidney is now twice the size. And this person ended up actually having fluid inside their abdominal cavity and got a systemic infection that, if it was treated as constipation, may have ended up much worse for the individual than the discovery of the actual kidney stone and putting the person on antibiotics, in this case, systemically, to basically prevent sepsis. So they prevented sepsis, and they, when the person was fit, they went in there and basically just pulled out the kidney stone through the urethra, and everything swelled or shriveled back down to its normal size and hunky dory now. But yeah, there's definitely an overlap between those systems. It's like a spider web. I mean, to think that, somehow we can create a synthetic human being that, does what we do and changes with time the way that we do to accommodate and mediate different changes in our environment and in our internal environment, external environment, and diet and whatever else. I personally, as a physician, and I'm not a genius physician, I'm just really interested in a lot of things. It's virtually impossible. Like there's just no way. There's no way to create a clone of a human being that is AI that can do all the things that we can do. We're just such fascinating creatures.
Right. Now, once that you do that vagus nerve reset, is that, I think you said that was not a complete fix or a permanent
Yeah,
fix?
well, it's a temporary. So if something is irritating the vagus nerve, such as this instability in the upper neck, when it irritates the vagus nerve starts firing inappropriately. And by, for example, doing breathing exercises, doing either cold water plunges or dipping your face in a ice water sink, you can have a reset of the firing pattern of the vagus nerve, absent of the mechanical irritation that's happening from the instability in the upper neck. And so depending on the severity of that irritation of the instability in the upper neck, you will reset the vagus nerve and the vagal tone. So your, for example, your POTS or whatever else will get better for a short period of time. And depending, again, on the severity of the instability in your upper neck and how fast it irritates the vagus nerve, it'll start firing inappropriately again. But there's multiple. So, for example, deep breathing, cold water, mindfulness, just thinking about wellness, as odd as that sounds, neuroplastically changes our brain to fire differently and have an effect on cranial nerves. Those are three and there's about 10 or 12 different things in the book that I basically emphasize as means of resetting vagal tone. Mm-hmm. But these are the 3 or 4 major ones that are easy and accessible for anybody to, especially the breathing one, for anybody to do at any given time, any day of the week, any hour of the day. And again, depending on whatever's underlyingly irritating the vagus nerve, you will regain the vagal tone temporarily, and what time frame that is will depend on the severity of what's actually caused it to go out of tone.
Gotcha. Okay, how do they get your book, and what's the name of the book?
The book is, if you just go onto Amazon, is the easiest, and you just type in my name, Sasha Blaskovich. So Sasha, and then Blaskovich is Blaskovich, and just search my name in the Amazon search, and the 2 books will come up. One is Dr. B's Concussion Breakthrough, which the goal of that was to expose whoever reads it or whoever's interested in that subject matter to the notion that a concussion may not necessarily be a concussion. There may be a component there that, in my case, mm-hmm. was grossly overlooked, and not because of lack of training, but just lack of them even thinking to go there, that the upper neck plays a major role in post-concussive or permanent post-concussive recurrent symptoms like what I have, that I wanted people to know about, so that at least they're exposed to it, so they're not oblivious to it, and most specifically doctors, because they're the ones that people go to for answers. And then the second one is the Vegas book.
Awesome. I will make sure we link these in the description. So if you're watching this video, just look down below and I'll have a link to both on Amazon. And then also, if you don't mind, we have a website. I think your assistant found our old website, which thankfully I still had access to. Mm-hmm. But our new website, we have a list of resources for authors, anything that I have found that's been successful, and so people don't have to recreate the wheel each time that someone has a brain injury. So I'll link that book on my website as well, if you don't mind.
Sure, absolutely.
Yeah. So if anything else that you want to discuss before we go, I'll give you a few minutes to just whatever.
Yeah, I mean, probably the most burning question that anybody would have after hearing what I've said is, well, how do you figure out if you have upper neck instability? What's the gold standard? What's the means of figuring that out? And for most things in medicine, it deviates to either MRI or CT, more so MRI than CT. But because instability is a dynamic phenomenon, you want to be able to visualize it in real time. And so the gold standard for determining instability versus no instability is motion X-ray. So it's basically video X-ray that is conducted, on a patient as the patient goes through their full ranges of motion in all 3 directions. And then based off of that, you can delineate in real time, because you're seeing the bones, move or not move. And you can dictate or determine whether or not they do have excess motion. And we make measurements. We do motion X-ray. We have a motion X-ray unit in our Washington facility for US patients, and we have one in our Canadian facility for Canadian patients. And every day of the week, we field people from all over the place, not just the US and Canada, but from all over the world, who come to get diagnosed because they're suspicious of upper cervical instability. And then we can also make measurements to quantify, I should say, how severe the instability is. And then from that point on, patients can take that information back to wherever they've come from and explain potentially to their chiropractor or to their physiotherapist or whoever's doing manual medicine on them why potentially the modalities that are being utilized or the techniques that are being utilized are flaring them up and potentially are contraindications for their particular situation, and that the treatment protocol should be modified to account for that instability. And then they can show the evidence of that instability to their treating clinician or physician, so that they're aware of the fact that they're indeed dealing with somebody who's unstable versus restricted. Because, like I said, it presents as a false restriction, but the true underlying problem is actually excessive movement.
Yeah.
Which gets governed by the muscles, and then so it deviates back to treating the muscles. And so the treatment modality or the treatment technique that I use primarily is termed pneumoreceptor tonus technique. And so it's a fancy way of saying do acupressure to basically reset the interface of the muscle to be able to sense the nerve telling it what to do at the appropriate time, so that it can govern that instability and reposition something that's going out of position because the ligaments aren't holding it in position.
Wow.
And so it all boils down to, permanent ligament damage, just like somebody who's blown out their knee playing basketball or football or skiing. That's a permanent deformity of that ligament. And if it's completely ruptured in two, they require, for example, surgery and bracing to be able to have a stable enough knee so they can continue to do activity. Right. And it's no different in the neck. It's just that the neck also involves the brainstem, which affects the entire body, whereas the knee will just make you not be able to do stuff that your knee's required for.
Right. Makes complete sense. Yeah.
That's pretty much it. Yeah.
Yeah. Thank you so much for being here today. Great knowledge that you've bestowed on us today.
My pleasure, Rob. Thank you for having me.
Yeah. And if people are in the Washington state, how do they get in touch with you if they want to come see you?
The easiest way is if they just type in whiplashclinic.com. That's the name of both the Canadian clinic and the U.S. clinic. And then from there, you can get all the contact information and reach out to us however they want to, either phone or fill out the contact form or whatever they want.
Amazing. All right. Thank you so much for being here today. I thank you guys for joining us. This has been Life Rewired. We'll see you guys next week.